Hey, what's up everybody? Dr. Tom over the Active Healing Center. Yes, we are back to Mobility Monday. We're going to hit on another common complaint people have in terms of pain in their body. You know, it's amazing to me, as unique as we all are to ourselves and how our body functions. But the amazing part is there's a lot of common areas of breakdown, a lot of common problems people have, because the body will break down and react very similar amongst all of us. And we hit one area before, which is this area, that piriformis muscle. We talked about that one here, where people complain of having pain right in the butt, literally pain in the butt. And it's because of that muscle there. Well, another common one is this one here, where you just, this constant nagging pain, this ache I have right into the top of my shoulder. And if we just look at what's going on with this, it's real easy to start to put a thought process into how to fix these areas. Well, that muscle that ties in right there, well, it's called your levator scapulae muscle. So if you break it down, it's a big fancy word, levator. It's an elevator, so it raises your scapula, your shoulder blade. That's the action of the muscle, to pick your shoulder blade up like this. So if we looked at it, that muscle originates from the very top four bones of your neck, right up in here. And it ties into this blade, the ridge of your shoulder blade, the top of your shoulder blade, it ties in right there. So what do people always complain about? Well, this is where I carry my stress, constantly tense, constantly tight, shoulders are up tight like this. So eventually what's going to happen? That muscle's constantly working. If we're constantly here, that muscle's in a constantly restricted position. There's always a breaking point. Eventually it's going to cause problems. And that's where it is. It ties right into that area, just constantly pulls on that part of your shoulder blade, hence pain, discomfort. But what else can it manifest into? Well, since it ties up into this part of your spine, well, how about being a trigger for problems like headaches, maybe jaw problems, maybe problems into your face, your eyes, ringing in the ears, because it starts to really throw this mechanism off and how that upper spine's function. And that part of your spine is what feeds into your entire head, your ears, your eyes, your nose, your sinuses. So certainly one, most commonly, would be headaches. A big time trigger for problems like that. So when we understand what's going on in terms of the muscles involved and the parts of your body that are involved, well, then it's easier to put a plan into effect to start to break it down and get us back on track. So some things that you could do at home. Mobility Monday, right? We're going to talk about our release. A lot easier to hit areas down in here to release because of just the way the mass of your body. It's a little harder to get into this area up in here to release. So definitely tools are needed to get into that area. This peanut here, this one's a real firm one. So if I'm going to start to release the muscle, so if our three main things here, right? Release, stretch, mobilize. Well, we're going to release that muscle tissue. I need a tool to get in there. I can use this one a little bit to drive some pressure into that, where that muscle ties into the shoulder blade. I can get into there and start to release that out. I don't have to go crazy. Again, you set your timer, 30, 40 seconds, a minute maybe, and work that area out. It gets a little harder. I don't like having to do this. Because what am I doing? If just the action of bringing my arm up like this to get into that part of my neck here, well, I'm working the muscle I'm trying to release. I'm elevating my shoulder blade. So that muscle is already being worked just by doing that. So kind of defeats the point there. I could try to get in there with this arm. Again, I can get it a little bit. So tools can be a little tricky. We need a tool for that, but this part of the spine just becomes a little harder to hit. You know, having a bigger tool like this, now I can get that one a little bit easier. All right, I can get into there. I can even get into the upper neck, work that area out. You know, if you're fairly flexible and mobile in your upper body, you can hit these areas pretty well. So definitely a tool like this would be my go-to to release that muscle. And again, a minute, 30 seconds a minute to work that out. So once we released it, then we're going to go into our stretch. So we're going to do a specific stretch to work the levator scapulae muscle. I like to put the arm back here. So if I'm working my left side, I like to put the left arm back here, or you could just picture yourself trying to pick up a suitcase off the ground. So you want this to be anchored. You don't have to pick something up, just hold that shoulder blade down. Again, I like to put it back here, kind of opens this up a little bit more. And what I'm gonna do is I'm gonna rotate my head towards my right shoulder, about 45 degrees towards my right shoulder, and reach up with my right arm, and I'm gonna pull my chin down into my shoulder, armpit area. Goal here is you need to stay nice and tall. We don't want to start rounding forward because then it makes it a lot harder to get into that muscle to stretch. I want to stay nice and tall, get in good position here. Pull that head, that chin into your right shoulder, armpit area, and you're gonna lock that down for 30 to 40 seconds. If it's real tight, you're gonna do it a couple times, but when I do that, I can feel it all the way through here. Mostly for me, I feel it up into this area, but you can certainly get that all the way down. The more your muscle releases, the farther down you'll work it. So goal is to be consistent with that, open it up. Now we're gonna mobilize it. Our go-to movement for this, the motion is your levator muscle, elevate your shoulder blade, so that's the motion we want, up and down. Nice and smooth, get those shoulder blades all the way up, all the way down. Again, maybe picture like you're picking up a suitcase off the ground, get it up, all the way down. That shrug motion, 20, 30 times. Really work that area out real well. Some other mobility movements we could do for the spine. We'll talk about these later, but this is a repetitive motion for the upper spine, and work that area out. That drives a little more motion into these neck joints and muscles. So we can do a repetitive traction like this. You can see this one over here is a repetitive cervical traction we can use as well. But again, that opens up those joints in the spine. Those are gold standard movements for your spine altogether. But that's how we start to hit those muscles here. The goal of this is always consistency. We need to be consistent. If this is a problem area, you have to be working this every day until you get this into a better functional, more workable position, so that you don't have this problem over and over again. So consistency is a key. The old saying, consistency trumps intensity. If we're consistent doing things every day. So again, make the spine, it's the core of your body, make that a part of your daily mobility routines. And then wherever we have problem spots, make that part of your daily routine as well. So if this is a problem area, then it needs to be worked on a daily basis. And what commonly people talk about is, well, they'll go in, they get massage, they get this worked a little bit, it feels a little bit better, or they do some stretching for a couple days, it feels a little bit better, but then they go about their life, and then a week later, well, here's the problem again, it's back. It's because you have to be consistent with this stuff. So if you are consistent with it and you're still having problems, then it's telling us that you have a lot more imbalances going on into this whole structure, head, skull, neck, upper spine. There's a lot more imbalances going on in there that are not allowing this problem to resolve. So you need some further help. And if that is the case, well, that's what we're here for. Give us a call. So, hey, let's get moving, get this done. And if you have problems, give us a call. We'll help you out. Take care.